have here is a goniometer. Keep in mind that the goniometer actually is composed of 3 different parts. We have an immovable or a stationary arm that's actually connected to the protractor, and then we have the movable arm that follows the motion of the patient. In the middle of the goniometer, where the screw is located, is what we call the fulcrum. The fulcrum is also lined up with the axis. So with that being said, let us begin with our goniometric measuring. Okay, we got Sade sitting on the edge of the mat with her feet free flowing. Notice that we have the towel in place. This is to elevate her so that she has the best possible stabilization. We will be measuring medial rotation of the hip. So that means we'll ask her to move her ankle away from her body, causing a rotation at the hip. We're going to line the goniometer up, and in this particular case the fulcrum is lined up with the anterior portion of the patella. The immobile arm will be perpendicular and remain perpendicular to the floor, and then the movable arm will follow the anterior portion of the tibia. Okay, so I'm going to ask our patient in layman's terms if she will move her foot away from well, let me say it this way. Move her left foot away from her right foot. So move out, keeping the fulcrum straight. I'm going to follow the anterior, keeping this part perpendicular. And then I read this to be 45 degrees. Ask the patient to bring the leg back. Okay, so we place the goniometer for lateral rotation. The fulcrum is at the anterior aspect of the patella. The immovable or stationary arm will stay parallel to the floor, and the movable arm will follow the anterior aspect of the tibia. Okay, so Sade, if you will move your left ankle towards your right leg. Following. Got it. And relax, and we get 30 degrees there.